want to thank you guys as well for joining us too. I know it's everything with the virtual space seems like we have more time but less time. So thank you guys so much for carving some out for us today.
You're welcome.
You're welcome. Thank you.
Okay, so did April's have to jump off?
Yeah, so what she did
Okay.
was she restarted her computer and
Okay.
she's gonna jump back on.
All right, I'm going to go ahead and start the cloud recording. I'm about to put you as a co-host, Cedric, so if you need to unmute someone that's not muting themselves, or if I don't get to it fast enough, feel free to do that as well.
Okay.
And then I am starting the stream, not starting it, but I'm setting it up right now.
Okay. Thanks, Ray.
So that will be Facebook, and I'm cross-posting to Volunteer United Women's Leadership Council, YLU, and then our main page.
Perfect. And my apologies too. I didn't introduce Ray.
Oh, hi.
So Ray is our Miss Do Everything along with Kim. Ray handles our social media, photography, and anything technological. Ray is a wizard at it. So, and then Kim is a great leader as well. She's the director of that department. So
Cedric, when I come back in, should I chat you or Ray, or to let you know that I'm
yeah.
in?
So if Ray,
Sure, yeah,
you just
you can put it at, so you can. I'm on 2 accounts right now so that I can preview what it looks like, because I'm a nerd. But you can do it to the United Way of Forsyth account of county here, where it says host. You can chat me there and I'll see it and I'll make sure, but I should be able to tell when you come back in, because I've got you on my list of speakers on the side.
Okay, I think I'm gonna miss April, but you guys are always recorded, so, but I'll be back.
Yeah.
Cool.
All right.
Thank you,
guys.
Reverend Brown. See you soon.
All right.
I mean, it looks like everything's pretty much
happy, wonderful.
what?
She's saying that her
Oh, I
mic
was just complimenting Cedric on being in brand.
Appreciate it, Kim.
I
Thank you
know.
guys for hooking us
I
up.
was like,
It's the first time I
might
saw
have-
anybody use it. I was like, oh.
I know, I might have a little cry.
Oh, April
I know,
says that.
I seriously might start crying.
Let's do it. April saying that her mic is not coming on. Are you back in the meeting?
Not yet. I don't see her.
We don't see you on the Zoom yet, April. Okay. Okay. Could you do it? Is it possible to do from your phone or?
recording and get the live set to go. Kim, can you share the live video into the Facebook event once it's up?
Yep.
Thank you.
All right, just gonna wait maybe 1 or 2 more minutes and we'll go ahead and get started. Thank you everybody for your patience.
All right, I'm gonna go ahead and turn my stuff off, Cedric, and if you wanna give me a countdown, I'll go ahead and make us live.
Perfect. Thanks, Ray. All right. Good afternoon, everyone. Going to go ahead and start on 3, 2, 1. Welcome, everyone, to our front porch conversation. We'll be focusing on the topic of faith-based health and wellness today, and we are excited about this conversation, as well as you joining us this afternoon. So welcome. And so at this time, if you could please place your names and the organization that you represent in the chat. Just want to introduce ourselves so that we know who all is joining us today. So I see a few names on that I know, but please just drop your name and the organization that you are representing today, so everyone can know who you are. All right, welcome, Chuck. Good to see you, my friend Jen, Casey. Good afternoon, Kim and Miss Suzanne. Thank you for joining us. Again, if you get a chance, please just drop your name and your organization that you represent in the chat. At this time, we're going to go to our slide just to kind of set the tone for our conversation today surrounding our work with the Place Matters strategy. So if you could, Ray. So we just want to highlight again the reason for this conversation. Why are we here on the front porch today talking about health and wellness? And so the strategy for Place Matters that we always want to go back to, which is our foundation, our core, is that our entire community is better off when all of its neighborhoods, one second, are healthy and thriving. And this is one of the key pieces here. Today, complex challenges need comprehensive integrated solutions. So when you think about faith-based community engagement, this is a challenge that I believe that including the faith sector is also a great opportunity to learn what everybody is doing, and so that we can continue to make sure that our communities are healthy and thriving, resident-led, and then again, focusing on asset-based community development, highlighting the assets within our community. We know that we focus on what's strong and not what's wrong. And so given that we have a lot of faith organizations in Forsyth County, as well as churches and faith organizations within our community, we want to make sure that we highlight these assets and some of the great work that faith-based organizations are doing to meet the challenge of faith-based health and wellness. And so with that, our last part is to convene community stakeholders, which is again why we are here today, making sure that we bring all parties to the table to have a great conversation around health and wellness, and making sure that when we leave here, we're more informed, but most importantly, we want to make sure that you go out and take action in your community to make sure that we all are living more healthy and we are making our communities thrive. So at this time, I want to introduce our speaker, April Smith. Our guest speaker today is April Watlington Smith, MS. She is an award-winning health educator, coach, consultant, and motivational speaker. She received her Bachelor's of Science in Public Health Education from the University of North Carolina, Greensboro, and her Master of Science in Recreation Administration from North Carolina Central University, with a concentration in worksite wellness. She is a certified wellness coach and diabetes prevention lifestyle coach. April has worked for work sites, municipalities, schools, and faith-based entities designing award-winning results-oriented wellness programs. She is an instructor at UNCG, teaching mental health and well-being to undergraduate students. And so we are excited today to welcome Mrs. April Watlington Smith to our front porch. So April, the floor is yours. Thank you for joining us.
Let's see, can you all hear me?
Yes.
All right, good. So I am experiencing technical difficulties, but that is okay. One of the things I learned in public health is we roll with the punches. So I'm so glad to be here with you all today. We're talking about one of my favorite topics, which is faith-based wellness. And so I'm excited. I'm excited to hear about the great things that you all are doing, and then share some of my expertise and knowledge with you all. So I have a PowerPoint, but again, I am experiencing some technical issues with my computer. So you know what? I'm just gonna go off the cuff and we're gonna roll right on through. So first of all, just a little bit more about my experience in the area of faith-based wellness. I had worked in health and wellness for over 20 some years. I have a BS degree from the University of North Carolina at Greensboro, focused in public health, and then a Master's of Science in Recreation Administration from North Carolina Central University. And so while working in the faith-based or the health arena, I have worked with work sites, municipalities, schools, in the faith-based community, and designing results-oriented wellness programs. Now, there are different types of programs that you can have. Some of you may have a participatory-based program, which is a program that's more focused on just getting people involved. So you may be rolling out cooking classes, fitness classes, doing a variety of different things, but it's not necessarily planned out. It's not outcomes-based. And so that's the other type of wellness program that you can have, one that's very strategic about meeting the health needs of your congregation as well as your community. And so today I'm going to share with you some ways of making your wellness program more outcomes-based and hopefully really having an impact in your community and changing the health outcomes. So with my slide, the next one we were going to go into was actually highlighting Black History Month and just focusing in on how churches have really become community change agents. And so if you think back to slavery, right before the Civil War, slaves were meeting in secret. And it wasn't until after the Civil Rights era or the Civil War that slaves were able to finally establish the Black church. And it represented freedom, it represented autonomy, it represented pride. And the church has always been seen as central to the village of the African American community. And so with that, it has been able to be instrumental when it comes to being leaders in political issues, as well as just issues in general that affect African Americans, and with health disparities, with just high prevalence of chronic illness. Churches still play a major role in being able to reach the African American community. Hold on, I'm looking at this on my phone. All right. And so we want to continue that. We want to continue to utilize that power that we have within our communities and being that central hub, that place of trust. Churches are seen as a safe zone. And so we want to continue to utilize that power and that influence by providing opportunities for the community. And so what I want to know in our chat, you all can post, is I want you to think about, how is your church using its power, its influence, and really changing the health outcome of its community? What are you doing? So post, share with us some of the things that your church is doing. And then I want you to think, how effective are we doing that? Are we really being strategic? Do we really have measurements in place of how we are going to really encourage people to adopt healthy lifestyle behaviors, or provide access to healthcare services? So really think about your program and how you're affecting change. Now, I have worked, as I mentioned before, with work sites. And one of the things that I do when I work with them, there's an organization called WELCOA. It's the Wellness Council of America. It's a national organization that's a nonprofit. And what they do is they establish benchmarks that, as a well workplace, if you work towards accomplishing these benchmarks, then the ultimate goal is that you will have a results-oriented program that you can show the impact of your efforts, show the return on investment in a sense. That same model can be applied to the faith-based community. And so we're going to get right into what those benchmarks are and how you all can utilize that to strengthen your wellness program. Okay, so the first one is leadership support. I want you all to think about your leadership. This is your pastors. This is your elders, your board members. How are they involved? What role do they play? And so when we think about this, think beyond just, is my pastor supportive of this? Because sometimes what happens is a church or organization may say, yes, we want to promote wellness. You go ahead and take the lead on that. We're going to assign a wellness coordinator. You run with that and just let me know how it goes. No, we want them to be more involved. We actually want them to be the face of your wellness program. There are studies that show that when your pastor is the voice, when he's actively involved, when he has that active leadership role within your ministry, you have a larger impact and your wellness program is actually able to flourish. And so really think about the role he plays. And that may be, in order to get him more involved, you may have to develop talking points. If you are your health ministries leader, sometimes pastors may say, okay, we need your guidance. Health is not necessarily my area of expertise. So I need you to let me know exactly what it is you want me to say, but really giving them an active role in your wellness program. So that's the first thing. The next thing that you want to also consider, the next step, is how to create a cohesive wellness team. Okay, who is on your team? So of course you're going to want to involve people in your church who have a health background. Maybe they're physicians, they're nurses, they're health educators, they're nutritionists, they are personal trainers, they are health coaches, they're mental health counselors, anyone within the health arena. Invite them to the table. But then you may have members who, let's say they've lost a large amount of weight and they have really embraced and are living what it means to be healthy. They've become passionate about it because they have seen how it's changed their life. Those can be some of your greatest assets, or individuals like that, or someone who's a cancer survivor, inviting them to the table as well. Are you involving your community partners? They may not always be able to come to your meetings, but are you inviting them? Are you keeping them in the loop when you send out your minutes from your meetings? Are you sending it to them so they know what's happening? Because what can happen as a result is the more that they see you doing, the more they're going to want to help you and maybe have access to additional resources or funds that can help grow your program. So make sure they're at the table. Another important group of people to have is also your other ministries. So I know in my church specifically, we have a children's ministry, we have a women's ministry, a men's ministry, a new believers. And so one of the trends that we are seeing with the churches, with the millennial generation, is that they're moving from these large gatherings to small, intimate groups. And so this could be a way, working with these other ministries, to really hit that population of people, finding out how to engage them in what you're doing, not just internally in terms of their help, but how to engage them with things that you're also doing out in your community. And so bringing those individuals to the table, that really makes a comprehensive wellness team. So then the next step, after we put our team together, now let's think through, or let's assess, what are the health needs within our community. So one of the things, and I'm actually still going to send Cedric the slides because it has a lot of resources, a lot of information. But one of the things that were on there is you have a great resource in your backyard, which is Wake Med, Wake Baptist Medical. They have a community health assessment that they provide to the community. So the health data that you would need for Forsyth County is right there. They have a dashboard. If you go to their website, then there's a dashboard, and they have 3 priority areas: looking at access to healthcare, looking at health behaviors, and looking at mental health. And you can see how your county, how it compares, or where it is on that dashboard. One of the areas off the top when I was looking at it is lung cancer came to mind. It was in the red. And so that's something that you might, as a church, say, hey, this is something we need to address within our community. Why is lung cancer in the red? How can we move the needle to green? Another area that I think right now is very important is it talks about depression, and there's a high depression rate amongst those who are receiving Medicare. So that's our senior population. And so thinking that through, is there things that our church can do to really address this issue? With COVID, we know that that's probably even more of a need because a lot of our seniors aren't coming out. So is there a way that your church can help keep them connected? So really doing a thorough assessment of what's happening, using your resources that are available to you. The health department typically does a health assessment as well. So going to your local health department, going to Wake Forest, looking at their community health assessment as well. It's very comprehensive. And so those are some ways that you can really assess. But then the other thing you can do as you're assessing your community is also assess your congregation. And so what are the needs of the specific individuals that you see every Saturday or Sunday when you are at church? What are their health needs? And one of the ways you can do that is to conduct a health needs assessment to find out what their current health status is, and then what their interests are. Oftentimes we can plan things, but we really haven't got the input of those we're trying to serve. So really making sure to really find out what are the needs, what are the interests, and are the right people at the table to make this happen, okay? So once you've done that, the next step that you want to take is you would want to start putting together your operation plan. So this is going to be the blueprint of your wellness program. And you want to be very strategic. You want to think through the goals and objectives. Again, there's some great resources in your community. United Way has identified 3 priority areas through its platform that Cedric has shared with you earlier that you might want to consider when you're putting together your program. one of the things that I saw right off is they're talking about strengthening the relationship with the police force. People may not always look at that as a public health or health issue, but it is, because last summer you heard a lot, at least I heard a lot from my community, friends who are Black, even myself as a mother of young Black children, just that fear, that anxiety that comes with knowing that potentially this is something that could happen to your own. And so really looking at the priorities that United Way has identified and seeing if there's a role that your church can play in addressing those things as well, and making that part of your strategic plan. With that, remember, we want SMART goals. So these are goals that you can measure, or SMART objectives, things that you can measure, things that you can accomplish. Okay, and there's a wealth of resources to help you with that. One of the ones that I had in my PowerPoint that I still can't pull up, Balm and Gilead. I don't know if you all have heard of this organization before. It's based out of Richmond, Virginia. They have a wealth of resources. They're an organization that really focuses on bringing faith and health together through the churches. The churches are the best platform to really address wholeness as an individual. And so Balm and Gilead, if you get a chance, visit their website, see the resources they have. If you click under program and then go to resource, you will see a whole bunch of topic areas. And under some of those, they actually have guides that you can print. So breast cancer comes to mind. If you click on their breast cancer, they have a pink Sunday guide. So if you're wanting to have an event at your church and you're needing ideas, they've already thought it out for you. And so that is something that you can just simply take a look at and follow the guide and implement it within your church. All right, so that's one resource. There's another, NC Church Partners is another one that has great resources. They actually have something on their site for when you are during this whole COVID. COVID has changed how we connect and how we serve individuals. We're having to move to virtual platforms. And so how to be creative in doing that. Everything from cooking demonstrations to even having on-site drive-throughs for your health screenings, or even just having a social event and keeping people connected. How do you have a safe COVID-friendly event? So they have different ideas on ways to do that as well. So really think through what are some things that you can do. This leads us to the next part, which is identifying those various types of activities. So once you've identified your goals and objectives, now you want to think through what are activities that we can do. Okay, what do we have the capacity and resources to be able to do and do effectively? So that would be your next step that you want to think through. And then after that, step 7 will be evaluation. What do we have in place to really assess how we're doing? Have we thought through how we're going to measure as we're going along the way? Okay, so for instance, let's say your church has discovered that chronic illness is a major concern, something that they want to address. So maybe you've partnered with your local hospital and asked them, can you come in and do a lifestyle change program with our church members? And we want to open it up to the community. And so with that, you might collect baseline data. Maybe you're going to look at their BMI, their weight, look at their fasting glucose. Maybe you'll do some type of basic screening, take their blood pressure. At the end of your program, then you would take those things again, and those would serve as your indicators of whether your program was successful. You can also look at behaviors and attitudes. Was there a change in their behavior or their attitudes, or what it is that they're doing? Have they improved their lifestyle behaviors? All right, so these are things that you really want to evaluate, because now that you can show numbers, whenever you're looking to get additional resources, support, or funds, you now can show the success of your program. But you also want to evaluate your capacity. What do we have the capacity to do? Are we really able to carry out all of the different strategies that we've outlined, or are all of the things that we see within our community that need to be addressed? Do we have that capacity? Or do we need to do what I consider step 8, collaborate? And collaborations are really important. We talked about power at the very beginning. There's power in numbers. And so when you can come together with other organizations, other churches, you can really have a larger impact on your community. One of the things, I used to work for a United Way some years ago, and I oversaw their health impact area, worked with their vision council, and we would assess the various things that were happening within our community in the areas of access to healthcare and health promotion, what's being done. And one of the things that we noticed was there was a lot of duplication of services happening like right in the same place. So there were a lot of great things, but there was duplication. And so the thought was, wow, if organizations would come together, there could be so much more, a larger impact, in that you can combine your resources and really strengthen your message within your community. And so I'll give you a couple of examples with that. I worked with the churches when I lived in Charleston. I was contracted out by the health department. And so they brought me in to address chronic diseases, particular heart disease and stroke. And so what I would do is I would work with the churches, particularly the women of the church, because they're the primary caregivers. So we figured that if we motivated them to embrace healthy living, they would take it back to their families. And so the health department put out a call. I think they were working with 5 churches at the time. 3 churches said, hey, we want to do this program, but there's just one of me. And so what we did was ask the churches, will you agree that if we rotate the sites throughout the year, that you will open your facility to the other participating churches as well as the community? Well, it ended up becoming an amazing thing, because not only were they able to continue to reinforce behaviors throughout the year with this group of individuals, but they created a support system within themselves. And so that collaboration really strengthened a program and impacted more people. That program, in a year and a half that I did it, served over about exactly 121 women that came through that program. And so you see how just pulling together your resources, how brainstorming, coming up with things can really strengthen and improve the health outcomes of a community. Same thing is true with some of the other things that you might be doing. Community gardens, if you realize that your church or your community that you serve is within a food desert. They don't have grocery stores. They don't have access to fresh produce. Perhaps your church maybe doesn't have the land to have a really nice sized community garden, but it's really something that you feel not only can benefit the community, but maybe be a source of pride for the community. Maybe connecting with the other churches and saying, hey, can we come together and perhaps find some land, ask the city if they're willing to donate, go in together and find someone who will help us maintain our garden. So you see, there's all kinds of ways that you can partner. One of the things that really comes to my mind, we go back to police, that is really an awesome way that churches can come together, really sitting down at a table and figuring out how can we build trust within our community and doing it from a united front. So collaborations are really something that I really push, because like I said, when it comes to health, not everyone has the same capacity and the same amount of resources. But if we work together, and it's all about uniting, the ultimate goal is really to improve health. And when we look at it from that perspective, then you recognize the power that unity, that collaborations truly do have within your community. So those are the 8 steps that if you apply these steps in that order, your program can have a larger impact within your community. And those are the things that I would encourage your church as you are building your faith ministry or your health ministries, or you are looking to grow or enhance what you're offering, to really just think through strategically, how are you providing your programs? Have you really thought through the outcomes and who to bring to the table to make it happen. I can't see the chat, so I was curious as to if there were any comments or any thoughts as I was sharing through these different steps. Are these some of the things that you all are applying? I want to hear more, and I know the next part of this, we're going to go into a panel discussion to hear some of the things that are happening in Forsyth County, some of the organizations and churches that are actually moving the needle when it comes to health and wellness. And so, but I also want to hear from those of you who are on, who may not necessarily be part of that panel, but just hear some of the great things that you're doing, or even some of the challenges, obstacles with us being in a pandemic. We've had to be more innovative. And so just curious, how are you continuing to promote health and wellness during this pandemic? And perhaps what are some of the resources or ways that I or United Way can better assist you? So please let us know, post in the chat. Cedric, I'm heading it back over to you so that we can start up our panel discussion.
Excellent. Thank you so much, April, for that wealth of information. And as she alluded to, we will send out that PowerPoint presentation to everyone on the call today and others who may want that information. I know that it is a valuable resource. So thank you so much, April, for rolling with the punches. And that last phrase you mentioned about working together and collaboration, I think it does highlight our model here at United Way to live united. So when people come together, organizations and community, we can do more together than we can separately. So at this time, April is going to slide into being one of our panelists. And so we want to welcome April, and we want to start with our first panelist, Reverend Angela Brown. Can you please just introduce yourself and tell us what organization you're representing today?
Yes, good afternoon, everyone. My name is Angela Brown, and I am the pastor at Shell's True Vine here in Winston-Salem, North Carolina. I am also, I work with Wake Forest Baptist Health and Faith Health Ministries there, where I have an opportunity to be in the community, providing various sources of resources, connecting not only just our patients, but those community members who are in need, caring for them for all of their different social determinants of health needs. And so those are just a few of the things that I do. Thank you for having us.
Excellent, thank you. Next, we will have Pastor Harrison.
Great afternoon, everybody. My name is Pastor Harrison. I'm the pastor of First Christian Church. I'm also the director of New Communion, which is a pantry in town. As we concentrate on trying to continue the uphill challenge of insecurity and hunger in this city. So that's a little bit about me.
Excellent. Thank you, Pastor Harrison. And so we have all been introduced to April. So we'll go right into it. And we'll start, I guess we could do this. We have some extra time. We could do a round robin, if you will. So we'll start ladies first with Reverend Brown. Our first question today is, how is your church or organization promoting health and wellness before and during this pandemic? So how's your church or your organization promoting health and wellness before and during this pandemic?
Well, so the beautiful thing for me is that both my church ministry work as well as my ministry work through Faith Health at Wake Forest Baptist Health are both walk hand in hand. So I have a lot of resources and partnerships and relationships with various organizations throughout the community. Resources through the Shepherd Center of Winston-Salem, Crisis Control, and just various different types of organizations that we use. So prior to COVID, like I said, many of our resources come through like the Balm and Gilead. I'm able to offer, and it provides African-American faith-based health and wellness toolkits. And so I love that because you can get it online. And before COVID, we could print them out. You could put them in your bulletins or have them out at different health fairs, events, and things like that, or leave them out in the lobby for your parishioners to get. So they would touch like all different types of diagnoses, topics of healthy aging, physical, mental, and spiritual, sort of a holistic approach. And so I used it a lot for the congregation. Also, health fairs we would do. And now I've sort of changed over to a lot of virtual health fairs. And so I'm continuing to promote those things in that way, especially with the job, with me working with the job, working on a vaccination right now for our 65 years or no population. And so that is a huge endeavor that we're undergirding, trying to connect to our community members and organizations and churches. So those are some of the things that have going on right now.
Excellent. Thank you. We'll jump right over to April. How is your church promoting health, or your organization promoting health and wellness before and during this pandemic?
Okay, so I actually just took over as our health director in November. And so we are too rolling out with the virtual platform. We are currently doing a wholeness challenge focused on eating more, eating smart, moving more, being intentional by showing gratitude and drinking water. So that's kind of the first round for this first challenge. We're in the process of planning a live in-person health fair. So it's either going to be a drive-through or a COVID-friendly event, and that would take place this spring, but still being able to provide the health screenings necessary to our community, doing it, of course, in a COVID-friendly way. There is a drive-through or depending on how things are in the spring. But we provide lifestyle change programs as well. And so one of the things that we will do coming up is address chronic disease through a lifestyle change program. So individuals with a BMI above 25, encouraging them to participate to make sure that they are lowering their weight. We do, actually, the CDC, they have a diabetes prevention type program. And so we utilize that model in helping people embrace healthy lifestyles to reduce their chronic illness. So those are just some of the things that we have been working on. We also are encouraging people to plant gardens at home. So create healthy environments, since we're spending a great deal of time in our home environment. So making sure that you're creating a space that is healthy while at home. So gardening. So this spring, we will be encouraging a lot of our members to do those types of things. And Cedric and I actually attend the same church. And so we've been very good. He's our community's engagement individual. So we've done a lot of things in partnership with the hospital as well as the university as well. And so they have done on-site vaccinations as well as COVID screenings. So we have been able to offer that during this pandemic.
Excellent. Great information, April. We'll jump right over to Pastor Harrison. And I can't wait to hear your answer to this, because I know you were right out in front of this with New Communion. So how has New Communion addressed health and wellness before and during the pandemic?
Yes, so before this, the whole frame work of how we operate is for us to actually be inside the community. So that has not changed a whole lot. Throughout COVID, we continue to still plug in to ensure that each person still is able to have food. That need has increased a lot now because a lot of our elderly folks in the community don't want to be out during this time period. So for us, we've seen a heightened awareness and more people leaning and depending upon us to be out in the community. So one of the ways that we've had to change is, we've stretched the things that we carry. So you have a certain framing of pantry things that you take out to the community. Well, now those things have changed. So along with the items that we carry, now we may carry toothpaste and toilet paper and all of the things that folks may need, and also to provide ways for people to connect. What has happened in this time period is it's been amazing to see as far as our church goes and the communities that we continue to serve, is this heightened awareness of we all being able to see each other now. Thing about knowing, you know, that COVID, you begin to every day you have. So, you know, we've been able to continue to provide, you know, pantry items, so to provide that support, because sometimes when we go out, we may be the only person actually in person. So it's, you know, throughout.
I think, David, we're kind of losing you there, Pastor Harrison. So we will hopefully get him back online. So thank you for sharing that, Pastor Harrison. You are spot on. I do want to point out too, early on during the pandemic, want to highlight some of the work that Love Out Loud and partnership with the Ministers Conference, in highlighting the fact that there was a great need for feminine hygiene products. So we don't think about those things. Pastor Harrison was saying about toothpaste and things that they normally don't carry. That was a huge issue, and it was great to see churches and organizations coming together to address that. And this is a live panel. We do have some questions that have been pre-prepared, but if you have a question, please feel free to drop it in the chat. And so we do have a question from Kim. She says, my sister is not mobile on her own, and COVID has been very tough on her emotional well-being. Is anyone on the panel addressing those seniors who may be homebound? So that's a question. We'll toss it up. Anyone can jump in there, April or Reverend Brown.
So I'll say this. I think stress, anxiety, depression, very much affecting seniors. It is on the increase or on the rise for a bunch of different groups of individuals. And I do feel like that is definitely something that we as a church need to address, not just for our seniors and keeping them connected, but also for our youth. I mean, if you look at statistics, they are showing that children as young as 4 years old are experiencing anxiety and depression. Suicide is on the rise when it comes to the Black community, when it comes to youth. And so it is very vital for churches, when we talk about churches having power and influence, they are one of those institutions that are really able to look at the whole individual, look at mind, body, and soul, all the aspects that make you a person. You know, we're complex individuals. It's not about just telling people, be physically active and go eat healthy foods. No, we are complex, and there's more that makes us who we are. And that there's more things that contribute to why it is we are depressed, why we are developing these diseases, why we see the prevalence, the rise of certain things that affect our community. And so the church makes for the ideal change agent, if you will, in addressing these things. And so if your church is able to partner with mental health organizations, or if you have mental health counselors who are part of your congregation, really focusing in on that and providing as much as you can services, whether they even be virtual. You know, I talked about the importance of small groups now. So maybe, I know not all seniors know how to operate technology, but those that do, you could create a virtual group just for them so that they can stay connected with each other, with their friends. So having a place for that they can go to stay connected, I think is very important. So yes, I definitely, Kim, I definitely think that that's something that all churches, if you're on here, I challenge you all to really think through how to keep our seniors engaged, but address the mental health of different age groups as well. So
excellent. Reverend Brown, I saw you were ready to go. Go ahead.
Kim, that's an outstanding question to ask, and thank you so much for you presenting something that's very intimate to the panel today. And yes, we are Faith Health. I am connected with various resources that is able to help those homebounds because they are really getting hit hard. As April did mention, we have all of our generations that are getting hit hard. But what you add the twist to the question was homebound seniors. And so there are organizations. I sit on the board of the Shepherd Center of Winston-Salem, and we have phenomenal programs. They cater and provide services from transportation to medical appointments to providing virtual types of senior support. And so, as April said, many of our seniors are not familiar, but they're also offering tutelage or tutorials for our seniors. And I think we also have an opportunity for them to like do a loaner or like an iPad or something like that. But I'm going to put my information in the chat. So if you would like to reach out to me, I'll leave that for persons. But yes, and also CareNet services is part of Wake Forest Baptist Health. And we have resources that we are now doing some telephone and virtual therapy sessions. So I would love to be able to do a referral for your sister just for that emotional support and different things like that. So yes.
Excellent. Welcome back, Pastor Harrison. Yes.
Well, no, I just wanted to add to the other, one of the other areas, and I'd be interested to know if any of the churches are doing this as well. So we recognize the need for mental health services and counseling. Domestic violence is also on the rise. And so that's another area that churches might want to consider.
I'm sorry, y'all. The internet here is special at times. But Chuck Spong kind of spoke to what I was going to chime in on this chat is every Tuesday, we're part of a program where we take out fresh produce and things to the elderly folks in our community here to promote people to eat right, but also, like I said before I when we went offline, to connect with folks in the community. Again, to see those unheard or unseen or untalked about needs that may be there, that may reside there, that we can serve as one point to connect them with other things every Tuesday when we go out. So that's one way that we respond in the community.
Excellent. Thank you. So we will take about 2 more questions. So we'll go into challenges and obstacles that you faced with your church or organization, or even personally with, I would say, this COVID-19 situation. How have you made that pivot and switch? And so we'll start back with you on this one, David. Did your organization have to switch or pivot? Were there challenges or obstacles that you had to face?
Yes. When COVID started, one of the things we had to do was really come up with ways to be safe while we're out in the community. A lot of the people that help us are elderly people, and my church is an older church. So it was, how can I do things as the pastor of the church to be responsible, but also in a way to make sure that they feel safe when they're out. So what we did was we came up with new ways to run the pantry when we're in the community. We came up with ways to change our schedule, but more importantly, within the church, we didn't want people to think because they didn't want to go out to the community that they couldn't help. So we came up with ways within the church to say, hey, if you're comfortable with coming inside the church but not into the community, help us prep the pantry. Help us stock the pantry. And, so folks can still stay involved with the work without being in the community itself. So that's really one of the main changes. And with the partners that we have, some of the site locations that we attend to, now they do things by signups. So we know the exact amount that we're taking out. They know how to hand off the food, so we don't have to stand out outside or in the community for the whole entire time. But we just came up with a way to be more strategic without saying we can't go out here and operate. So that was the main thing. I mean, when COVID started, you know, we all kind of paused and said, you know, what do we do now? Because the work that we do, we're out here. And
right.
we still, you know, at that time, we had no idea what all this was about, you know, how easy could it be called, you know, all these things. So, you know, we paused, breathed, stepped back, and came up with a way to say we can still serve the community. It's just coming up with a creative way of doing so.
Absolutely. That's an excellent point you mentioned at the end as well, Pastor Harrison. You are on the front lines, and you know, April and Reverend Brown, this is frontline work. And so I just want to highlight that as well, that you are in the community especially at the beginning stages, not knowing all the risks, but you were still there serving. So we're going to go right to Reverend Brown. Any obstacles or challenges that your church faced or your organization faced during the COVID pandemic?
Yes. So similar to what Pastor Harrison was mentioning, you know, people sort of put a screech on, hey, you know, I'm not going out into community. And so we had to find ways, you know, Faith Health was called upon to do so many different things, and we pretty much had to figure out who we were in this new age. And so definitely connecting with our partners from Love Out Loud and the Ministers Conference and other churches or organizations was essential to us to see how we can get some things moving. Us being the motherboard of the mobile clinic, that was one a crucial point of really having the churches connect with the mobile clinic and then providing food. So the challenges was, one of the challenges that we came across was our seniors who were homebound and could not go out to the grocery store, did not want to go out to the grocery store. And so getting meals and groceries to them. So we galvanized through our Stick Center efforts, and my colleagues there was able to galvanize different, and with Rachel Zimmer of the mobile clinic, to different ways to get food to our seniors who was not able to go out. So those are some of the obstacles. Also, seeing that our parishioners that were active and now are more confined to their homes, so there's no more way of socializing that brought vitality to their lives, had come to a screeching halt. And so now trying to figure out ways as a church, how can where the seniors would come in and do their senior aerobics or exercise in the church, or come together and go out and eat their weekly lunch for mental health, you know, and social, as Kim alluded to for her sister. So trying to come up with ways, and like our ministries have evolved and not changed. Some have changed, some have died because they had to evolve to something else. Maintaining healthy eating habits. When monies are low, let me just say it like this. When our people monies are low, they're going to buy what their food can afford. So I see that as an obstacle, as Kim mentioned, how can, you know, about healthy eating. But when my money is funny and low, I have to provide what I can for the household. So there goes the healthy eating out the door. So now as a church or as an organization with Faith Health Baptist Hospital, I have to figure out ways to teach our people how to use what you have in a healthier way as best as
Excellent
possible.
Point.
And then and I'm gonna let it go. But one of the key things that was major is that galvanizing PPP, in other words, gloves and masks. You know, Reverend Chuck Spong is on here, and Love Out Loud, many churches, one of my churches, one of their partners, Ministers Conference as well. We, you know, Mask the City. I'm sure we've all heard of Mask the City here. And so after all of that, it was such a huge undergirding and great success, but I still was able to get access to gowns and gloves, and I still created a little mini distribution out my garage and able to go out and get those things out to people. So those are a lot of obstacles, trying to want to be safe, but want to get the things to the people. Those are some things, right? Challenges.
That's good. That's really good. Thank you. Really quickly, April, if you can touch on that point, and we have one final question that I just have to ask. Go for it.
But we have the same type of challenges as everyone else. I will say, when it comes to healthy eating, I think one of the things I'm hearing is I'm stuck at home, and so I am eating. And so people are putting on the COVID-19 in terms of pounds. And so just finding ways to keep people engaged and connected. I think that's been the challenge that we have faced as well. And like I said, I've just took over this role, so we're really still trying to assess, but trying to figure out how can we evolve with this COVID, especially, and is it here to stay in a sense of this new way of doing things? So that's been our challenge. Cedric, can I really quick, I wanted to, before I see Jen Casey made a comment about meditation, and I wanted to just really quick comment on that, because she said intentionally planning, scheduling, facilitating meditation practices, don't know if there are specific outcomes. And one of the things I will say that I have heard from people is when it comes to managing their stress, that they're finding meditation to be beneficial, not just the act itself, but making time for themselves. It's funny, we're at home, but and I'm a mother of young kids, so maybe I'm having a lot of conversation with other parents, but virtual learning, having your kids there, trying to work,
Right.
Finding that free time for yourself has been a challenge. So being able to just say, I'm taking 10 minutes to just have peace of mind and to be able to participate in something like a meditation practice is actually very, very, very beneficial. And one of the ways that she can measure that outcome is stress level, their reported stress level. How did they feel prior to starting the meditation program? And then how are they feeling after, now that they're applying that to their daily lives?
Absolutely. Thank you for touching on that, April. Excellent point. Definitely meditation, prayer, that is something essential during this time that we definitely need. And so I would be doing my due diligence. I know we have only a few minutes left. Can we please touch on the topic of the COVID vaccinations within the African American community? We know right now that it is at a low when it comes to vaccinations with our community. Can you please just touch on that briefly? We'll start with Reverend Brown.
Oh, well, awesome question for me. So literally, I am for the last week or so have been working on galvanizing persons to come to an upcoming event this Saturday. And so, and I just got off a call to come to this one so that we are strategizing how to get our older population, the 65 years and older, to this event and more events ahead. And so Faith Health have been heavily involved with many organizations as well as Novant, just really collaborating together with the community. We all know, or many of us know, that Novant has been heavily seen in the community at different locations. And Wake Forest Baptist, we are also making headway as well, along with the health department. And so what I would like to say for those that who have members or persons who are in our African American communities, so 65 years and older, who is in need of their first vaccination, please have someone to contact me, because I can possibly get them in this Saturday, as early as this Saturday for an event. If you get on the wait list, I have more to come. So that's what I want to make sure I get out in my portion of answering the vaccination.
Excellent, excellent. Thank you. That's very pertinent information. We'll jump over to Pastor Harrison.
Awareness. I mean, that is the main thing that we're trying to push in the community, to let folks know where they can go to get their shots, how they can go to get it, to let them know that it's not as impossible as it seems. For some reason, that seems to be the story, that, oh, I just can't get into this place, or I'm trying to log on to this site and I can't do it. I've been trying to call it, just trying to make sure that everyone knows that it's possible. And, we're seeing it all the time. Take for myself, my own church, a lot, I also of my folks. So, it's been, and
All right, I think we lost
all the people. Here are all the places that you can go to get this shot, and just folks know that it's with which is a big thing and a big.
All right, April, you can go ahead and jump in. I think we lost Pastor Harrison.
Okay. So piggybacking off of what everyone else has said, awareness, definitely. If your church has an opportunity to provide the vaccinations, and even continue to provide screenings, definitely sign up, become a site to provide those things. But in doing that, you're helping establish trust that that this is something that you're supporting the community, the Black community, getting the shots. I think that's vital too. So by being a site, you are helping establish that trust.
Perfect. And we will bring our panel discussion to an end on that note. Thank you all, Reverend Brown, Reverend Harrison, and April, for being a part of this. I've seen, Reverend Brown, you dropped your information in the chat. April, if you can do the same, let folks know how to contact you. If you are in need of a COVID vaccine and you're having issues, as Chuck Spahn mentioned in the chat, access, please contact Reverend Brown with Faith Health to see if we can make that happen. I want to make sure everyone is safe out here. So with that, thank you everyone for joining us for our front porch conversation. Thank you again to our panelists. Thank you again to our amazing support team, Ray and Kim. And thank you guys so much for joining us. And we will see you again soon. Take care, be safe, and stay healthy.
Thank you.
Bye, thank you.
Well, thank you.
Bye-bye.
Cool. You good, April?
Oh, I forgot we were staying on. I cannot believe.
You don't have to.
Oh,
Yeah.
oh
Okay.
my goodness.
I just ended the live stream and
Okay.
I am stopping recording.
Okay.